Hello everyone, my name is Elisa and today I will briefly introduce the National Health Policy of Malaysia. So, the National Health Policy of Malaysia was created by the Ministry of Health Malaysia. It serves as a guideline to improve the healthcare system and ensure better health for Malaysian citizens. So, the policy was first established in 1966 under the First Malaysia Plan. Its purpose was to provide a clear direction for the development of healthcare services and to meet the changing health needs of the society. For this policy, the Ministry of Health Malaysia is responsible to implementing and monitoring this policy. It works with government agencies, private healthcare providers, and also international organizers to improve the health and well-being of the Malaysian population. That's all from me. Thank you.
Hi, let's go to my part 2.0 issue. In this topic, we have two subtopics, each are cost and benefit. First, for the cost, one of the main issue is contrast in human resources, healthcare facility, and medical equipment. Public hospital often face shortage of staff and medical equipment, which can affect the quality of the healthcare service and increase waiting time for patients. Next, climate change and the decline of planetary health also give negative impact to healthcare. Problems such as flood, haze, and pollution can increase health risk and cause more diseases among the public. Another issue is contrast in healthcare financing. Rising medical costs make it difficult for the government to maintain quality healthcare service while keeping treatment affordable for citizens. However, despite this challenge or cost, the National Health Policy also provides many benefits. Firstly, if improve access to healthcare service, more people can receive better healthcare treatment and public healthcare service become more accessible. Secondly, community health teams help provide health education and guidance to the public. This help increase awareness about healthy lifestyle and disease prevention. Lastly, digital healthcare system allow easy access to medical report through online medical record. This makes treatment faster and more efficient.
The National Health Policy in Malaysia has clear objectives. First, experts use SWOT analysis to study the main issues. At first, there were 10 areas of concern, but they combined them into several because some strategies can solve more than one problem. Second, the policy aims to give citizens high-quality healthcare. In Malaysia, this quality is guided by the SEREMBAN framework. SEREMBAN means healthcare that is safe, timely, effective, equitable, efficient, people-centered, and accessible. The goal is to improve health outcome and make sure citizens have a better experience. Service should be delivered by a team in a caring and professional way. The first objective is safe. Health service must protect both patients and providers. Hospitals need strong infection control, careful use of medical tools, and training to avoid mistakes. Patient information must also stay confidential. The second objective is timely. Service should be given on time without delay. Using online booking, digital files, and better scheduling help reduce wasting time. Timely care improve recovery and reduce overcrowding. The third objective is effective. Healthcare must use proven treatments, new technology, and skilled staff. Effectiveness means measuring outcome, analyzing data, and improving service. This prevents waste and ensure patients get the right care. The fourth objective is equitable. Service must be fair for everyone, no matter gender, race, location, or income. Policies like mobile clinic and campaign help rural and urban citizens get the same quality of care. Equity also means respecting cultural difference. The next objective is efficient. This means using resources in the best way without waste. Hospital and clinic should use technology and proper processes to increase productivity. Efficiency also means reducing costs but keeping good quality. The next objective is people-centered. Healthcare must respect patients, listen to their needs, and involve them in the decision. It is about teamwork, empathy, and professionalism. When services are people-centered, patients feel valued and satisfied. The other objective is accessible. Service must be easy to reach physically, affordable economically, and clear in information. Facilities should be located in convenient place, cost must be reasonable, and current health information should be provided. Digital technology also helps make healthcare more accessible. In short, efficiency, safe resource, center care improves satisfaction, and accessibility ensuring no one is left behind.
For the point 4.0 is actor involved in policy programs or activity. First is Ministry of Health. The Ministry of Health is the main government agency responsible for planning, developing, implementing, and monitoring health policies in Malaysia. It plays an important role in identifying national health issues, setting health priorities, and ensuring that healthcare services are accessible to all citizens. Second is healthcare providers. Healthcare providers include doctors, nurses, pharmacists, hospital, clinics, and other healthcare professionals. They are responsible for delivering healthcare services directly to patients and implementing health policies at the operational level. Healthcare providers also provide valuable feedback regarding the effectiveness of health programs. For the third point is World Health Organization. World Health Organization is an international organization that supports countries in improving public health and developing effective health policies. It provides technical experts, research findings, guidelines, and recommendations on various health issues such as disease prevention, health promotion, and emergency response. World Health Organization also assists governments in addressing global health challenges and encourages international cooperation. By sharing knowledge and best practices, World Health Organization help countries strengthen their healthcare system. For the last point is academia and research institution. Academia and research institution contribute to health policy development by conducting scientific research and providing evidence-based information. Their studies help policymakers understand health trends, evaluate existing programs, and identify emerging health issues. Research institutions also provide expert analysis and recommendations that support informed decision making. Through research findings and policy evaluation, they help ensure that health policies are effective, relevant, and responsive to the needs of society.
Next, I am going to explain 5.0, which is the implementation strategy of the policy. 5.1 explains the establishment of an implementation plan and the ways to communicate it. Basically, we can create a clear implementation plan with goals and timelines. We can also provide funding, workforce, and necessary resources. Next, we can communicate policies through campaigns, media, posters, and leaflets. Moreover, we can conduct workshops, meetings, and seminars for public awareness. And lastly, we can define responsibilities for healthcare agencies and workers. Next, in 5.2, we have to set up trial programs in gathering areas. Firstly, we can test the policy in selected areas before nationwide implementation. Next, we can identify weaknesses and improve the policy early to avoid any mistakes. Moreover, we can apply the policy under real-world conditions. Then, we can provide training and skill development for healthcare workers to make their job easier. And lastly, to ensure the policy is effective, practical, and sustainable. Thank you.
Next is the evaluation on the effectiveness of the policy. So one of the main strengths is its ability to provide affordable healthcare services to the population. This allows people from all income groups, especially low-income families, to access quality healthcare without significant financial burden. Another strength is collaboration between government agencies, private healthcare, and non-governmental organizations. This cooperation helps improve the delivery of healthcare service. Next is weakness. One major weakness is overcrowding in government hospitals and clinics. Because healthcare services are affordable, so many people will rely on public healthcare facilities, which can also affect patient satisfaction. Another weakness is the shortage of healthcare workers. Many hospitals and clinics face a lack of doctors, nurses, specialists, and pharmacists. Next is opportunity. One important opportunity is strengthening cooperation between the public and private healthcare sectors. It can help reduce overcrowding in government hospitals and also can improve healthcare infrastructure and services. Another opportunity is the growing awareness of healthy lifestyle among Malaysians. This provides the government with an opportunity to expand health education and promote healthier lifestyles throughout the community. One major threat is the rising number of non-communicable diseases such as diabetes and more. As the number of patients increases, healthcare costs may rise, hospitals may become overcrowded, and healthcare resources may become limited. Another threat is Malaysia's aging population. Older adults are more likely to experience chronic illnesses and require ongoing medical attention and medical spending.
Next, I'm going to explain 7.0, which is the recommendation. In 7.1, I'm explaining how to strengthen healthcare facilities and workforce. Firstly, by building more hospital and clinics, especially in rural areas. Next, we can recruit and train more doctors, nurses, and specialists. Moreover, we can improve the salaries, career opportunities, and working conditions. Next, it can reduce staff burnout and workload pressure for all employees. And lastly, we can improve healthcare efficiency and accessibility. And now in 7.2, I'm explaining how to expand preventive healthcare and public-private cooperation. Firstly, we can promote healthy lifestyles through health campaigns. We can hold many health campaigns in many areas around the state. Next, we can involve schools, workplaces, and communities in health awareness to help spread the awareness. Moreover, we can reduce diseases such as diabetes, obesity, and heart disease. Next, we can strengthen cooperation between public and private healthcare sectors so they can work hand in hand to help the other sector out. Lastly, we can create a more sustainable and people-centered healthcare system that works for all. That is all. Thank you.
For the conclusion, the national health policy in Malaysia is really important for making the healthcare system and making sure everyone can get good healthcare. The policy is about giving people safe and timely healthcare that they can get when they need it. The government wants to make sure people healthier and make sure they get the healthcare they need through the national health policy. Compared to countries such as India, Malaysia generally has better healthcare infrastructure, a higher doctor to patient, and wider access to healthcare services. However, both Malaysia and India faces some of similar challenges, including increasing healthcare costs and shortage of healthcare workers. Therefore, continuous investment in healthcare facilities, technology, and human resources is essential to ensure a sustainable and high quality healthcare system. Overall, Malaysia's healthcare system remains one of the strongest in the region and continues to improve to meet the needs of its population.